pressure pain at the isn't it the mastoid bone that you call it here in the,
Yeah.
like on the outer edge of the occipital ridge there. Is that immune?
It can be. It can be a number of things. I mean, immune is usually a little bit below the mastoid. Okay. Whereas if it's literally on the mastoid, there are two types of people that show that. One is ear type issues. Person will show that. And the other kind of person that shows it is people with autoimmune disorders often will show it.
Okay.
Okay.
Sorry, the line was a bit fuzzy there just on the very beginning. What
Okay.
you said in the beginning.
Okay, so immune is a little below the mastoid. It's more kind of behind the, I mean, the SCM obviously needs the mastoid. I mean, it's named after the mastoid, but the actual bone itself, what's attached to the bone, anything that's puffy and attached to the bone, is either autoimmune or ear infections. And if you go slightly below, that's immune. That's more clearly immune. You know, although you can say, well, autoimmune is also an immune, you know, quote unquote, but still, you know, there's a slight, you know, as opposed to, you know, when we say immune, you mean like tonsillitis type. You know, originally immune point was called tonsillitis point for people who've had their tonsils removed. So, make sense?
Yeah. This person actually has had some ear problems actually, vertigo and that.
Oh, okay, yeah, that's pretty. So, you know, I would start with possibly Sanjiao 8, spleen 7, maybe kidney 9 also. Look at that.
Okay. Okay, thank you.
You're welcome. Hello, Anne-Marie. How are you? You have to unmute yourself.
Hanging in, still not working, but getting ready.
Getting ready, yes. So
yeah.
process.
Since I do home visits, and a lot of the information has been, of course, for clinic-based acupuncture. I have to figure out, since I'm the vector, how to not be a vector. But yeah, just working on that, figuring out exactly what I have to do, protocols. But eager to get back. I've got one patient. She's 96.
Oh, wow.
And the last time I saw her, she has extreme edema in her lower legs. You know, and of course, the Western doctors want her on Lasix, and she has a bad reaction to Lasix, and so she won't take the Lasix. She won't put her feet up. You know, she's 96, strong-willed. She landed in the hospital in the ER Friday morning.
Oh, sorry.
So I've been on the phone with her son, who of course can't wait to see me again. Because it was very interesting. I've been treating her for that, and she's got, at 96, there's a whole host of things that's going on. But the edema has been slowly getting worse, and nothing seemed to really kind of kick it. The last time I saw her, I did Moxa. I'd done Moxa the previous visit, not much of a reaction. So the last time I saw her, I did the Moxa again, CV 9 and 12, and then I did Xeon and Stomach 35, just sort of, you know, surround get you know, the knees, get some circulation. And and the thing is, the leg was so swollen, it was red, purple, blue. I mean, it was, you know, it was kind of scary for me to see that, because the, you know, nurse practitioner hasn't been doing a thing. As I'm sitting there, her legs started just oozing the water, like from all the pores. And I'm taking my, paper towels, and it's just, she had her feet on a pad, and the pad was just soaked. And it's just, I'm like, holy moly. And by the time I left, it hadn't stopped, but it's like, yeah, just keep an eye on it. Keep doing the, soaking it, use your paper towels. By the time I left, it was not purple, not blue, and much less red. It was like phenomenal. And then we had the shutdown.
Mhm.
And now she's in the hospital for that. So I'm really eager to get back to see her, because she'll be there for a couple of days. And then when she comes home, I'll be able to treat her and, hopefully stay ahead of all of that. But it was just, this medicine is amazing. Yeah, I'm not sure what I expected as a reaction. How is this body going to get rid of all this water? It's just like, yep, we're just going to send it out through all the pores of our lower legs, just like floods.
So here's a suggestion: when you do see her, you might want to consider spleen 3, spleen 7, and spleen 11. And I'll tell you how to find, 3 is obvious, but 7 and 11, and 11 especially, is not so obvious. The main point is spleen 7, literally behind the bone. Look for a dent. Now, in her case, probably everywhere you press, there's pitting edema. So spleen 7 is just going to get lost in that. But spleen 7 should be a place where there's either a nodule or an edema kind of situation. And that's
so
your
a
main
palpable
point.
Something.
Yes, yeah. And with edema, it's usually edema. So there's something that's going to be more of an edema than anywhere else, and literally behind the bone. No, don't, some people take the spleen channel further away from the bone, but in this case, it literally, you want it, just behind the bone. Spleen 11, what you do is it doesn't have to be, I don't even know what the official definition of spleen 11 is. I don't recall if it's 6 and above or whatever the hell it is. But what you do is go above spleen 10 and pinch the skin. And where there's a thickness in the skin, that's probably the best spleen 11. And it's more of a shuttle point, because spleen 7 is your main point, spleen 3 is a supporting point, and then spleen 11, because there's all this edema, you need something above the knees to send the stimulation out. And if you can do direct marks on spleen 7, it's good. And you can, for some people, they'll show pressure pain.
At spleen 7?
No, I was going to give you reflexes that you can check if you're on the right point. So some people will show pressure pain on Ren 9. It's called shui fan, dividing the water. So they may have pressure pain on Ren 9. They may also, sometimes they have pressure pain on stomach 28, which is called shui dao, the pathways of the water. And then the other thing is, I'm assuming that she's a cardiac case, or not necessarily.
Yeah, the heart and the kidneys aren't working. Yeah, she's got some pressure on the heart because the kidneys aren't doing what they're supposed to do.
So it's really a kidney issue.
From a Western perspective, yes.
Yeah. Oh, no. I mean, so, and the heart and the cardiac is secondary. So what I would do, okay. So I would check, for example, if the kidney can show just outside kidney 16, a little more lateral, or on the back, around, T11 to T12, anywhere between the bladder point and the bladder line and the Watteau.
Okay.
The pressure pain. So even if she's lying face up, or in her case, you might be treating her sitting. I don't know, because
actually, she's obese and has a lot of difficulty moving. So I treat her sitting in her comfy chair.
Okay, fair enough. So so it's might be a little hard to get behind to check the kidney shoe area.
Yeah, I have done that. I've actually done I haven't done MOX, but I did infrared on the whole, on
Oh.
bladder 23, 52, that whole area.
Okay, so, and then I would even, yeah, in bladder 52, I would even needle bladder 52 towards the spine. And in your case, since you're doing it sitting up, and she can even lean back and have weight on the needle because it's literally towards the spine, so there's nothing sticking into her back. So you can do
Yeah.
it at the same time that you're doing this, the spleen 3, 7, 11. You can do the bladder 52. So I would check either, either, T11 to L2 between the bladder and the Watteau, or you can check maybe even REN 17 or some cardiac reflex
Yeah.
to see if spleen 11 makes it better, if spleen 7, sorry, makes it better. So you have a way of checking that, okay, these points are actually, supposed to be doing something because
Yeah.
they're releasing a reflex.
Okay. Okay. Thanks.
But yeah, it's always amazing when, like you get something like so drastic happening. So
It was, yeah, and it's funny because her son was, after the fact, he said, I should have taken a picture before, because, just to have the before and after pictures, to show, show the nurse practitioner, although she's pretty on board with acupuncture. She's, yeah.
Well, bring a bucket next time.
Seriously, yeah, it would have been interesting to see the quantity.
Yes. Yeah.
But yeah, of course, right now she's on the Lasix, and her son's like, yeah, there's tons of fluid leaving her body. I'm like,
yeah.
So,
Oh.
but yeah, she's really sweet. She's Polish, strong-willed, and elderly. I love treating the elderly because they have stories. And they love to tell her stories. So those are my peeps.
Oh. Anyone else?
They really, I find a lot of them like sleep for ages on the table. You don't feel like disturbing them again.
Yeah. Yeah. Although I have some that are pretty elderly, they're very, very, they need you to be in the room and talk the whole time. Zoning out is just not their thing. So it depends on personalities, obviously, but yeah.
Yeah. But yeah, most of my patients are very glad to have me there to talk to, because they're pretty isolated.
Yeah.
And especially now. One of my patients called me just to see how I was doing. So
That's nice.
yeah, she's really sweet. Yeah, and I have very interesting patients, I have to admit. She has, have you ever heard of cyclic vomiting syndrome?
Cyclic, like as in cycling?
Yeah.
Okay.
It's there's a strong mental emotional component to it. I had one CVS patient when I was in clinic and school, and something will trigger it, usually mental emotional, and the vomiting just keeps going. And my current patient, she has to go to the hospital and have the very specific multi-drug cocktail to kick it. It's that alone has kept her home and isolated.
Yeah. So just in terms of ideas, to try other more things if you'd like. Usually with something like this, I can't guarantee because it's not like I have tons of experience with this kind of thing, but stomach 9 we call primitive reflex. It reflects primitive things. The name of the point is welcome human, welcome to being a person. So often when people have nausea, vomiting, bulimia, things of that nature. Often they'll have pressure pain on stomach 9, as well as possibly the SCM, because it sounds like part of what's happening is it's a nervous system disorder. You're saying it's when the nervous system, something triggers off emotionally. So it may be the nervous system. So releasing the vagus nerve, opposite side Sanjiao 8, could be very useful. And also look for the bumps on the stomach channel below stomach 40, but close to the bone. So anywhere between stomach 40 and including even stomach 41, all of these may be helpful. And kidney 9 sometimes can be very helpful for that.
Yeah, we've yeah, I mean she's on a lot of meds to begin with, but none of them really touch this. And right now her last incident, gosh, it was in the fall, I think, late summer, early fall. She woke up in the middle of the night. It's usually like between 3 and 5 liver time. She wakes up, there's that whole emotional piece, and she fell in her bathroom and broke her jaw. Yeah, she fell so hard on her face, and so she's going to have surgery. And they for some reason the ER said, oh no, your jaw's not broken. So like 2 months later she went to a TMJ place. They took another x-ray and they're like, yeah, right there you can see, and she could see the break. But the idea of having her jaw wired shut is
not very nice. Now,
so,
you're saying she wakes up 3 to 5, and you're saying it's liver time, but isn't liver time 1 to 3?
1 to 3. I'm not 1 to 3 liver. Yeah. She's, it's the middle of the night. And yeah, the last time it was her mother triggered. It was her mother's birthday, and there's just that whole emotional. But she's also on. There's this nasal spray that's kind of like a narcotic. That she can feel when it's coming on. There are a whole says a prodrome. So if she does that, it usually nips it. So she hasn't actually had a full-blown episode since the fall, which is great. But she's complicated. Her diet is terrible, and she knows it. But yeah, so I will take a look at those points next time I see her, because I've done all kinds of different things. Treating gallbladder meridian has been really helpful. So yeah.
Thank you. So, anyone else?
I would like to hear more about stomach 9 and its other applications. That's very interesting. I've never heard that before about primitive reflex.
Oh, okay. So most of the application of stomach 9 is really as a reflex. I do needle it primarily to release the neck, to release C4, and which is phrenic nerve. So again, related to, so its primary relationship is really to the autonomic nervous system, because it is kind of part of the SCM, component. So, and then the other thing that stomach 9, well, actually, there's another place I do treat stomach 9 for, and that is for male urological problems, especially, so male urological problems are much more tied to the autonomic nervous system than female urological problems. In men, there's a very strong correlation. And also stomach 9 and kidney 11 are both places that, you have your hyoid bone and you have your pubic bone. and they're both horizontal bones. Now you do have another one, which is the collarbone, which is another horizontal bone, but there's two of them as opposed to the pubic and the hyoid, which there's only one. So they reflect each other. They reflect the two ends of the Ren channel. Okay, so they treat each other. And another one that you can consider in this concept is spleen 15, which is called the Great Horizontal, Daheng. So those 3 points relate to each other and can fix each other. Okay. The strongest relationship is between kidney 11 and stomach 9. So, for example, I've had patients who they come after some sort of orthopedic surgery where they get a spinal block, and those can create urinary blockages. And so I release stomach 9 with Sanjiao 8 first, but then I actually needle it. And that's very helpful. I've had one guy who came in, he was self-catheterizing. And he, then after the treatment, he went, he said, "Oh, it feels much better." I said, "How do you know? I mean, you have to try and pee," So he did. And he said, "Oh, it's I can do it without the catheter." And it's one of the only time, well, actually, no, there was one more. But when someone says, "I want to come tomorrow," and I said yes, because usually I don't like treating too often, the next day. In my opinion, it's can get you diminishing results by overtreating. I'd rather wait 3 days if possible. But so he did come the next day, and then he never used the catheter afterwards. And so, it definitely is a really good point for male urological issues. It can reflect blood pressure because it reflects the autonomic nervous system. So it's not going to reflect blood pressure issues that come from renal problems, but it will reflect blood pressure problems that come from either the autonomic nervous system issues or also from plaquing because it's on the carotid. So it is going to reflect that. Yeah, and the primitive reflexes, things that are not really, that kind of happen like without too much thought. So, it's primarily nausea, the things like vomiting, nausea, things of that nature. That's why bulimia is in there also. Or people get nausea, well, again, because it's nauseous from smells and things like that. They can show on stomach 9. It's just somehow it's a bridge between the brain and the rest of the body. And even though there's obviously lots of, the whole neck is the bridge, somehow stomach 9 seems to reflect that a lot more strongly than most places in the neck would, or more reliably. Because obviously the neck is, there's a large area. I do a lot of palpation around the neck, the SCM, the scalenes, the cervicals, there's a whole bunch of stuff that I check in the neck. But stomach 9 is pretty reliable for things like that. Things that are just kind of like primitive functions in the body and without much, that are done without, awareness, consciousness, or control. That's it. And I try and release that first with the stomach chi points, those bumps along the stomach channel, possibly kidney 9 and Sanjiao 8. I really only needle stomach 9 for 2 purposes. One is to release the back of the neck, the C4 area, and the other is to for male urogenital issues. Those are the 2 main things that I'll actually needle. And I use a 0.12 needle, the dark green, the sarin dark greens, and 15 millimeters. Just so, this way it feels safe because, we've all had so much training about being careful about stomach 9 because of the carotid, blah, blah, blah. So the thicker the needle, the more chances you have of doing something to this poor artery. Although in my opinion, with the needle I'm using, the artery moves. There's just no, it doesn't, the needle's just not thick enough to penetrate the artery. I would say for most people, at least.
Yeah, I've done a number of cadaver labs, and one of them was cephalic, and saw the carotid artery, and I was amazed at how thick it was. Just seeing it physically, I'm like, there's no way a needle or with gentle touch. There's no way a needle could get in there because it was just, we cut it open to see actually how thick the wall was, and I was just amazed.
Yeah.
But yeah, I mean, the precautions are there for a reason.
Yeah.
It may
Well,
have been
they used
not
stone
difficult.
needles in the early days, so it's a different story.
Right. But it was just, after hearing, going through, all the point location and living in that, all the academic stuff, and then to actually see a real carotid artery, it's
Yeah.
like, wow. So,
Yeah. So that's pretty much most. I think that's all I have to say about stomach 9. I might be wrong, but that's what I can't recall anything else right now about stomach 9.
Well, it seems like it would have some good implications for migraines. I'm surprised that you don't include that. Especially, I mean, there's vomit, oftentimes
Yes.
cyclic vomiting with migraines.
Yeah. Well, it would, as a reflex, yes, but not as a treatment point. So, but as a reflex, my primary at that point with migraines, it becomes, for me, that's the stomach 9 part becomes merged into the whole SCM, because the whole SCM is important with migraines. So it's I don't think of it as separately.
Okay.
Does that make sense?
Yes.
That's why I wasn't really including it. But yeah, of course, because with migraines you often have nausea, vomiting, and it's certainly not in control. Yeah.
And do you have any special way of needling it? I mean, aside from the size of the needle.
So I press from the hyoid bone side. So I'm on the front of the SCM, because otherwise it becomes large intestine 18, right? So and then I needle behind the SCM and slightly down. So I'm going back and down at the same time. And this way and by pressing the SCM away from it, you're basically taking the carotid artery away also. But I'm definitely needling it laterally and downwards. I've never needled it upwards, so I can't, and that seems to be totally safe. And that seems to be the thing that solves it. I will say I have many, many, many years ago, this is almost 30 years ago, needled not stomach 9, but large intestine 18, which is, so the Chinese also say large intestine 18 is very good for neck, but you're supposed to really needle it, So I've actually used a 2-inch needle on large intestine 18.
Whoa.
Yes. Well, because the idea is you're basically supposed to affect the front of the facets, the front of the cervicals. That's the whole point. It's like doing surgery. See, this is when they started doing neck surgeries from the front. Okay.
Right.
They used to do them in the back, and then this is just when I graduated from school. It was this whole thing. So this one person from China said, "Oh, large intestine 18 is very good for neck," and yes, it was true. But I mean, it was like I didn't do that for a long time afterwards. But I did do it for a little while, and I was like, this is like really doesn't feel so comfortable. And then as my style got a lot gentler to begin with, and I kind of don't own a 2-inch needle at this point to begin with. So stomach 9 is kind of more my style, with just gently, a teeny bit of the needle. And because the thing is, if you're vibrating the needle, the vibration will get all the way back. Granted, you have a good 3 inches to get to, but you don't need to have the needle touch the tissue you want to affect. But I was a younger practitioner, and that made sense at the time, and it worked. So it was like a cool trick, and plus it was very it's like needling bladder 1 with a 2-inch needle. And especially I've done it on myself too. So it's kind of like there's a certain machismo about, well, look what I can do, which over time you lose. You don't care so much about. But as a younger practitioner, it's kind of, you want to be able to feel that you have I don't know if it's the versatility or whatever. It's, you know, you want to feel like you're in control. You can do whatever it is. And then you go, who cares? It's not really all that important. At least for me. For other people, that's their style. They definitely need that. So.
Yeah.
So anything else, Camille, on stomach 9?
No, thank you.
All right. Anything else?
When somebody presents, Abby, for just extreme tiredness, other than like treating the reflexes, is there anything else that might help, do you think?
Yeah, a few possible, well, there's zillions of possibilities for tiredness, obviously. You know, I would start with a medical history, see what can clue you in. But so with tiredness, it could be, you know, there could be a bunch of liver possibilities. So I would check the liver. I would check REN12 because it's also possible that they're not absorbing food and or, you know, the small intestine. So I would press on the navel with a flat palm, not REN9, not kidney 16, but my whole palm pressing on REN9 to see if there's anything there. I would obviously check the pulse, see if the pulse says something to you, because, you know, if they're tired and the pulse is strong, it's kind of different than if they're tired and, you know, it's one of those pulses that you can barely feel and it's very weak and it's very, you know, not held, or, you know, there's just different options within the pulse, you know, and I'm definitely not a great pulse person, so I don't want to overdo this, but there is somewhat of a difference if they have a strong pulse. So it could be that they're not absorbing food, which can be either the stomach or the small intestine. It could be the liver. It could be an autonomic nervous system disorder. You know, so people like supposedly they should have all the energy. In other words, the food is, but the nervous system is just constantly sending the signal of like, no, you know, I'm tired. I'm, you know, I'm not engaging. So it could be really a nervous system disorder as well. So therefore check the neck, etc. And then it could be a bunch of immune possibilities, both autoimmune or just straight out immune options. So those are the 4 things that I would look at, kind of, you know, to find out. But I think often it's within the medical history that's going to point you either to one of those or to something else. The medical, you know, it's going to suggest something, hopefully. Does that make sense?
Yes, it does, yeah.
Yes. So.
And thyroid, perhaps, I would think.
Yes, sorry, absolutely. Yeah, definitely thyroid could be a major, and that, by the way, can be both hypo or hyper. Thyroid can cause tremendous fatigue. But that will show, I mean, that will be very unusual if somebody in the Western world, at least, comes with strong fatigue and has no idea that there's something wrong with the thyroid. It will be, you know, that will come in the medical history, you know, because it's, I mean, very few people come to us first. You know, they usually have had the primary, you know, check something. So it'll be kind of unusual if I was the person who said, and by the way, you should have but it can happen.
Well, and yeah, I mean, there's so many possibilities. You know, if and this would certainly be reflected in liver, but also cancer comes to mind.
Yes.
That they may have an undiagnosed cancer.
They can have an undiagnosed cancer. They can have, for example, internal bleeding. You know, I mean, there's a zillion. Yeah, absolutely, yeah. And that's what I mean. That fatigue itself is not a good judge of treatment. You know, there's usually something else that comes prior to. There's a reason why there's fatigue. You know, it's not. it's, you know, it's not a primary symptom, even though it's a very common symptom that people complain about. It's hard to treat fatigue as a primary symptom, as the cause, because it's usually coming from elsewhere. Does that make sense?
And in our constant tradition of Mary Jo's questions, trigger questions for me, what about mitochondria issues? Like, what if it's something that, you know, the mitochondria is not engaging?
Yeah, it was funny. When I was thinking, how does, you know, how does that one know that? And quite honestly, I don't have. It was funny. I was thinking, what would be the acupuncture metaphor for that? And the only thing I was coming up with was REN3. And if it's REN3, then possibly do 24 also. But I honestly can't guarantee. I mean, it's purely theoretical. But yeah, there are people for whom everything in the organs supposedly works right, but the cells themselves can't function because there's something in the cell itself, you know, which could be mitochondria or it could be maybe something else. But you know, that the cell itself is unable to respond or produce or whatever. And so the reason why REN3 is called the central pole, the Zhangji, and that's why I'm thinking it might have something to do with mitochondria, but I'm not totally sure. It's hard to, yeah, it's a weird, it's something I haven't really thought about. You know, I kind of know that it's a possibility, and I've never really thought, what would one do with acupuncture with that, and experimented with it. I mean, so Camille, I mean, I'm assuming that within the functional medicine world, there's a bunch of things that they recommend.
Well, yes, but what we tend to do is look at it more from a nutritional standpoint of where are we not feeding the Krebs cycle?
So
like you can actually do a lab where they assess every substrate of the Krebs cycle, and you see if for example one step the substrate's very high and the next step it's very low, you know that one step is not being made and that there's a buildup. And usually then you would look at what is the nutritional cofactor that might push that step along. But it just suddenly occurred to me when Mary Jo asked the question, you know, is there something, you know, from an acupuncture standpoint to sort of get the motor revving a little better, so to speak?
So again, it's a little theoretical. So let me ask you something, just as a question. So these cofactors that you're looking at, you know, whichever part of the cycle, do they tend to be minerals?
Oftentimes minerals, yes. So that's a good point, that I guess the mineral treatment would
yeah.
And then B vitamins also tend to be pretty important.
Okay, so if it's a B vitamin, then REN12 is very important, both as a reflex and possibly moxa as a treatment. So I would start with immune point to fix REN12 and kidney points to fix REN12, as well as stomach chi can also. So B12, the absorption of B12 is very important, and is done through the actual, you know, the stomach lining is very important for it. That's why REN12 is so important as a reflex.
You cut out for a moment. Could you just say what you'd use for absorption of B12?
Yeah. So you want to, REN12 would be the reflex, and the treatment points will be immune point, stomach chi, and kidney points, either 9 or 7. And then I can actually moxa REN12 as well, direct moxa on REN12. I prefer not to needle, but you could needle if you wanted to. then something escaped me. I was thinking of something else. Oh, and if it's mineral, you have your mineral treatment, which is kidney 6, spleen 10, heart 3, small intestine, small intestine 8, and Ren 6, which all have ocean in them. But also, if you, the other point that you can look at, like to push the, to push the cycle, as you said, is kidney 27. Because the name of the point is the shoe of the Fu organs. So those are, I mean, it's because the like I said, this is theoretical because I don't have like a patients that I can say this was the day, because I don't do functional medicine. And I can say, okay, this was the thing, and it's clearly there's a mitochondrial miscommunication, and the Krebs cycle is not working well in this stage or something like that. I don't have that experience to be able to say.
Mhm.
And then when you use this point, it's the equivalent of giving, such and such supplement. I don't have that. But and by the way, kidney 27 is an important, even though it's not part of the mineral treatment. I usually add it because it does have a mineral capacity. It certainly has something to do with calcium. Because it has to do, it's the so-called, you can say it's the moo point of the parathyroid. And so it has to do with leaching, calcium out into, from the bone into the blood, or the other way around as well. Okay.
That's fascinating. Thank you.
Yeah, well, let's hope it's right. I mean, it's fascinating, but it's not proven.
So moo point of calcium. So you would use that also for, say, for example, parathyroid issues.
It's the moo point of parathyroid.
Ah,
It's the moo point for the parathyroid, which controls calcium metabolism.
okay.
But okay, so there are systems, for example, in the TBM system, they use kidney 27 as a reflex point for muscle testing minerals.
Oh,
So, so there's clearly amongst different systems there's clearly something in this area of kidney 27 that has a relationship to minerals.
okay. So if no one else has any other questions, that leads me into parathyroid treatment. Oh my, that's a heavy sigh.
Well, because well, here's the story. Okay, so you have a parathyroid moo in kidney 27, and I think it's T2 is the shoe point of the parathyroid, if we're going to use that. But here is the it's not so much, and actually there was a recent something about parathyroid that I was working with. I'm sorry, I don't recall the details of what it was, etc. But the thing is with parathyroid, oh yes, I had yeah. This is a patient who's had cancer, and she had high parathyroid values, and the first thing they want to do is basically remove it.
Mm-hmm.
It's kind of like it's a dogma. It's an absolute dogma. They do not want, and I was just kind of shocked. And the woman is, well, the thing is, the woman is 80, and I'm like thinking, do you really want to go through surgery at this point, et cetera, et cetera? And thankfully, they gave up the idea. But so yeah, so that's what it was. So the thing with parathyroid is this: parathyroid, if the parathyroid, generally speaking, the problem is the parathyroid is too active, right? So the parathyroid gets overactive when the adrenals, the gonads, adrenals, and thyroid get low. Okay.
Oh.
Well, it's isn't it considered antagonistic? Is that not is that not like standard dogma? I thought it was standard dogma out there. That the parathyroid. Okay, so look at it this way. I'll tell you, since it's not standard dogma, I'll tell you why I think it's standard dogma. No. I'll give you the rationalization for it. So, and then if someone can go, that is bullshit, and that's fine. I'm accepting that it could be totally bullshit, but okay. So here is the story. When women go through menopause, it means that we say the kidneys are weak, but really it means the gonads are weak. Okay, so there's a weakening in the gonads, in the ovaries. Okay, and as a result, the parathyroid over time is not being controlled, and it becomes stronger. So as the ovaries go down, or gonads or kidney or adrenals go down, the parathyroid is antagonistic to it, so it starts getting stronger. It starts getting stronger. It starts leaching more and more calcium off the bones. You get osteoporosis. Okay, that's my way of thinking about it. If someone has a good rational, a better explanation that it's true, or a better explanation to say this is what you just said is absolutely rubbish, I'm perfectly happy to buy that, to hear that. But that's my understanding. So if I'm treating parathyroid, it's like I'm treating the lower jiao. Again, by the way, notice the relationship between that. We talked before, kidney 11 and stomach 11, and stomach 9 and kidney 11. They're two opposite ends of the ren. You want to strengthen the lower dantian, the lower jiao, in order to make the parathyroid less crazy, less hyperactive. It's about consolidating the lower jiao, if that makes sense.
So how would you strengthen the lower jiao?
Okay, so kidney points, number one. And number two is take Ren 4, go to the side to Mushu, and do it that way. And possibly inner yin. So you're strengthening the lower jiao by giving it more lift of the perineal floor. Support the perineal, the lifting of the perineal. That will support the lower jiao. So yeah, I mean, if you were doing it herbally, I guess you would be looking at doing something like Heshu Wu, or Shu Bi, or something like that. But from an acupuncture perspective, it's literally creating the support from the legs for the pelvic floor, so the lower jiao has more springness to it, as opposed to dryness to it. So it's not shriveling, so to speak.
So I don't know if you know this off the top of your head. I'd have to think it through. If we pulled in Jeffrey's blood and fluid model, would we consider it a yin hormone or a yang hormone?
I can't answer that because that model is something that I've never fully understood.
Okay.
So unfortunately, I don't have a good, I don't have an answer on that.
Well, the gist of it is that you have the yin hormones and the yang hormones. So yang hormones are like adrenals and thyroid. Yin hormones would be like estrogen. Well, okay, I'm sorry. In addition to yang, you'd also, of course, add in testosterone. And then on the yin side, more estrogen and insulin. Because does that hormone make the body yin, or does it make it more yang? And I never really thought about parathyroid hormone and whether it fits into yin or yang.
Right. Well, you would say that it destroys, if the now this is totally theoretical, because I really, but if parathyroid hormone is leaching out calcium into the blood out of the bone, it's definitely not building the blood, because the blood sure does. It's leaching the calcium, I believe, in order to supply something to the brain, not something to the blood. I could be wrong there. But I don't think it's the blood that wants the calcium. The blood couldn't give a damn about the calcium, and I believe. I could be wrong. So it's basically destroying the yin, the structure of the body. So now it's up to you. Do you consider that to be a yang function, as in burning the yin? Or, I don't know, but, that would be, and it's kind of interesting that, we have So there is this model, and by the way, parathyroid is often left out of a whole bunch of hormonal models. It's very common that it's like it doesn't exist. We
Yeah,
talk about
it's interesting.
insulin
I never even thought of it before.
because it's not pituitary based. So
Mhm.
nobody wants to, that became a political statement. Nobody wants to, but I think because it's not a pituitary influenced gland, it's taken out of the axis of hormones in some weird way. Because it doesn't talk in the same way that we're used to with all the other hormones. So we kind of left it away. But I was thinking, that so Jeffrey has this model of yin hormones and yang hormones and water and blood and stuff, and yet he too has left parathyroid out of it. In other words, Mr. Jeffrey, but why don't you classify this gland also?
Well, just because it's not in my brain does not mean that he left
didn't.
it out. I mean, he can talk for 2 or 3 days on this. Well, he can talk for a month on the subject, and I gave you this
Yes.
30-second version.
No, I know, but I hear you. But I'm just saying that it's
Yeah.
very common that the parathyroid is being left out of these models in general.
Yeah.
It's just for some reason it's like it's like the stepchild of the hormonal system. And we can even see in the way they treat it. It's like you've got a problem, remove it. What the hell? That's
yeah.
Is this Jeffrey Yuen?
Yes.
Yes. I'm sorry. Yes.
Thanks.
So anyway, so that would be my my take.
Thank you.
That but I can't say if it's yang or yin is a little bit different. It's so much dependent on perspective.
Yeah.
How you want to consider it.
Jeffrey would tell me to go meditate on it, right? So
I bet he will, and then you can meditate for 20 years and and may arrive at absolutely nothing, or you may arrive every day at a different conclusion. So
yeah. So there you have it.
yeah, I mean, we do. I mean, I would say meditate and experiment, because otherwise,
Yeah.
it's kind of like, what do we know? It's kind of like, well, if a certain point or a certain herb, or I meditated and I arrived at a certain theoretical conclusion, and then I could prove it, then great, then it's good. Otherwise, Anyway. So, anyone else? All right. All right. So, I will be here on July. Oh, it's not July 4th next Monday. It's after it's just the July 4th weekend, I guess, or something. So I will be here. Enjoy your week. And yeah, that's pretty much it.
Yeah, I
And
think
it's
people
rainy
have
here.
Friday because the holiday's on Saturday. I think people have Friday off, not Monday off. So
Oh, okay. I couldn't figure out, the exact meaning, etc., etc. It's a foggy, rainy day, so my brain is not operating quite at full speed.
Well, I really enjoyed today. Thank you so kindly, Avi. Thank you very much.
Thank you, and
Thank you. Thank you
enjoy
for
the
your
week.
advice.
Have a good
Bye.
4th of July, guys.
Bye.
Bye, everyone. Thank you.
Thank you.